Good morning. I'm Jim Bradley. I'm the orthopedic surgeon for the Pittsburgh Steelers and the past president of the American Orthopedic Society of Sports Medicine. I'm here to show you a new device that was developed, which I think has a lot of promise. It's basically a needle within a needle, and it's got high strength polyethylene as the suture, which is used in many surgeries. What its primary use is, there's two things about it. Number one, temporally, timing-wise, I'm much faster using this than I would with a normal whip stitch. Secondly, because of its configuration, there's almost 3 or 4 different stitch configurations that you can make from this, depending on what size tendons you're using on. So remember that you can use this on Achilles or lateral collaterals or ulnar collateral ligaments. And the beauty of the thing is it's sophisticated yet so simple. So you simply can separate it like this. I've already done a little work on this one, and you simply just take it around the tendon, put it together, and then the second needle that I put in there is not sharp at all, so you're not going to hurt your fingers. And then you simply just grab it with both hands like this, push it right through the center, make sure you push the whole way through, and then you just pull it through like so, and you already have your first stitch. It's that fast, and it's reproducible, and you can tension them sequentially. You can tension them down, and you can move through. Once again, separate the two of them, easily put it together, and that's blunted in there, so you're not going to stick yourself. So there's no getting stuck involved with this. Drop both through at the same time, push it in, pull it out, and tension. You see how fast this is. So then there is a modification that I particularly like, and because that way that, sometimes when you do these whip stitches, what happens is they shred the tendon a little bit. So you want to distribute the force over the tendon in a different manner so that doesn't happen. And there is a way to do that. And the way you do it is you lift it up again, you put it through, and you don't tighten it down the whole way. So you just leave this here, and you leave the 2 little figure of 8 loops there, and you take both ends of the needle, take it underneath, pull it through like so. And now what you're doing is you're creating this locking stitch, and you slide it down easily, and now you can tension both sides. And what you're doing is, when I do the next one, you'll see, but your distribution of the force is going to change. So you go down under. When you separate it, you just leave the ends. You get this little baby figure of 8 up here, and you just make sure that you've got your fingers in there, and you just separate them like so. Then you take the ends, and you make sure what side you're on is what side. You stay on the same side. So in other words, this belongs on this side, this belongs on this side, and you simply put your fingers through like that. I like to make a little tiny X. It's easier for me to do it that way. And then you tension them down. The beauty of it is it's now distributing the force over the tendon, and it's not ripping the tendon, which sometimes we get in trouble with. So I think strength-wise, pull-out strength-wise, it's excellent. So I think you might want to give this a try to speed up your stitching of your tendons in the OR.